welcome to the deep dive. So today we're tackling something pretty important, I think. It's really relevant for therapists, obviously, but honestly, for anyone. It's about understanding diverse perspectives. We've got this really fascinating set of guidelines looking at how culture and identity, shape how people see things.
Yeah, and for listeners, it's not just academic. It's like a shortcut to understanding nuances you might miss otherwise. It goes way deeper than just surface differences.
Totally. Our source is basically a text outlining, well, best practices maybe.
Yeah.
For psychotherapy with different groups.
Right, but the insights, like you said, they're useful everywhere. Just understanding the sheer complexity of how people tick in different contexts.
Exactly. So our mission today, let's try and pull out the key takeaways for specific groups. But, and this is crucial, we need to understand these potential cultural influences without falling into stereotypes, right?
Absolutely. These are guidelines, potential patterns, not boxes to put people in.
Think of it as getting a more, finely tuned radar for understanding others. Okay, ready to dive in?
Let's do it.
All right, first up, African American experiences. The guidelines mention this core worldview emphasizing interconnectedness and prioritizing the group over the individual. What strikes you about that?
Well, it's fascinating how that collectivist view can really change how someone sees their place,
Yes.
It's just a different calculation than in more individualistic cultures where often it's me first.
Right, so it affects how you solve problems, your sense of responsibility.
All of that. And it's interesting how you frame that, what one culture might call dependence, another sees as like healthy interdependence. It's just a different lens.
Yeah, that's a really good point. Dependence versus a strong support network.
Exactly. And that network, that family structure, it often goes way beyond parents and kids.
Right, the guidelines mention the extended kinship network.
Yeah, extended kin, close friends who are like family, and often the church plays a massive role too.
So family is just a much, much broader concept.
Definitely. And that gives you a huge base for support, for resources, even for how decisions get made. It shows real strength, that network.
And within that family, roles are often quite fluid. More egalitarian, men and women sharing roles, kids pitching in.
Seems so, yeah. Flexibility, shared responsibility. You can't just assume traditional rigid roles.
Okay, now this concept really jumped out at me. Healthy cultural paranoia. That sounds, well, like a contradiction. What's that about?
Yeah, it's a powerful term. It's not clinical paranoia. It's more like a heightened awareness, a cautiousness maybe, developed as a protective shield against historical and ongoing racism.
Okay, so it's a realistic response to potential threats, not just an individual thing.
Exactly. It's born from real experiences, systemic stuff. It's a way of navigating potentially hostile environments.
Wow, okay, that reframes things. So knowing that, how do therapists build trust? What approaches work?
Well, the guidelines really push for these eco-structural or ecological systemic approaches, like Boyd Franklin's multi-systems model, meaning you look at the whole picture, the individual within their ecosystem, family, church, community resources, social services, all of it, and you empower those existing networks.
So therapy isn't just the hour in the room.
Not at all. It's about understanding all those layers. They also mention more action-oriented stuff, time-limited, goal-focused, problem-solving approaches.
Suggesting maybe a preference for seeing tangible results.
Could be. And really emphasizes egalitarianism, a collaborative relationship, therapist and client on the same level, not hierarchical.
Which leads to this really practical tip. If you're a non-African American therapist, they suggest you actually bring up the race difference in the first session. Ask how the client feels about it.
Yeah, it's proactive, creates space to address it openly, builds honesty right from the start, gets it out on the table.
Okay, let's shift gears. American Indians and Alaskan Natives. The guidelines talk about a worldview that's deeply spiritual, holistic. Harmony with nature is key, and illness is seen as disharmony.
Right. A very different starting point. Health isn't just biological. It's about balance with nature, with the spiritual world, within the community. Illness means that balance is off.
And socially, the focus is strongly on the extended family and the tribe, more than the individual. Decisions are often made by, group consensus.
Exactly. Consensual collateral decision-making. The group's well-being and agreement often come first. It's a very collective model.
Their view of time is also interesting, more tied to personal and seasonal rhythms, very present-focused rather than future-oriented.
Yeah, that can be a big difference from, say, Western clock time obsession. It might affect things like scheduling, long-term planning. Gotta understand that to avoid misinterpretations.
Values like cooperation, generosity, and listening more than talking are also highlighted.
Mm-hmm. Humility, thoughtfulness in communication, respect for elders and for silence even. Important interactional nuances.
And history seems absolutely critical here. The text stresses that therapists need to know the historical context, colonization, treaties, assimilation policies.
It's non-negotiable, really, that history has caused deep, lasting trauma that profoundly affects mental health and relationships with the dominant culture today. You can't ignore it.
And related to that, clients might actually prefer a therapist who helps them reaffirm their cultural values and might distrust therapy that claims to be value-free.
Makes total sense, doesn't it? They want their identity respected, integrated. A value-free approach can feel like it's erasing a core part of who they are.
So what are the practical guidelines for therapy then?
Building trust is number one. Huge. Show respect, show you've done some homework on their culture, but also be humble about what you don't know.
Okay.
And be collaborative, client-centered. Avoid being too directive or confrontational. And this is key. Be open to involving elders, medicine people, traditional healers.
Right, weaving in traditional practices.
Yeah. And that idea of network therapy, bringing family and community into the treatment, it fits perfectly with that collective focus.
Makes sense. Okay, moving on to Asian Americans. First thing mentioned.
Yeah.
Huge diversity. Country of origin, acculturation level. It all matters hugely. Generalizations are risky.
Extremely risky. Asian American covers so many distinct cultures, languages, histories. You absolutely have to ask about the client's specific background and how connected they feel to it. No assumptions.
But are there any common threads? Acknowledging that diversity, the guidelines mention things like group focus over individual, maybe more hierarchical families, traditional gender roles, valuing harmony.
Yes, while keeping the diversity front and center, those themes do often appear. Collectivism is common family, and community needs often come first. Respect for elders, clear roles, and a real emphasis on maintaining harmony, avoiding conflict, fulfilling obligations. Those are frequent values.
And that value on restraining strong emotions to keep the peace, avoid shame. That must really affect how distress shows up, right?
Oh, absolutely. Openly expressing intense anger or sadness might be discouraged. So distress might come out differently, maybe through somatic complaints, physical symptoms.
Ah, okay. So headaches, stomach issues could actually be signals of emotional pain.
It's a common pathway, culturally. Also, there might be a preference for therapy that's more directive, structured, focused on solving specific problems and symptoms.
Like, here's my problem, help me fix it.
Kind of, yeah. They might see the therapist as an expert who will give concrete advice and a clear plan. They want tangible results.
So the therapist is initially maybe more of an authority figure.
Potentially, yeah. But it's still key for the therapist to encourage the client's input. Balance that expert role with collaboration.
Got it. And there are specific tips like maintain some formalism initially. Be aware of shame and obligation. Realize modesty isn't low self-esteem. Focus on behaviors first.
Exactly. Little things that show respect and understanding. Formality builds trust. Knowing how powerful shame or family duty can be is crucial. Modesty is often a virtue, not insecurity. And starting with concrete behaviors can feel safer than diving straight into deep emotions.
And therapies like CBT, solution-focused brief therapy, are often good fits, but might need tweaking.
Yeah, adapting them to explicitly include family context and cultural factors is often necessary. Make them culturally relevant.
All right. Next up, Hispanic Latino Americans. Again, the first point is diversity. Lots of nationalities, regions.
Yep, same caution applies. Huge richness and variety. Cuban, Mexican, Puerto Rican, Salvadoran. All distinct cultures under that broad umbrella. Always ask, never assume.
Core values often include familismo, the deep family loyalty and interdependence, maybe being less likely to share intimate details with outsiders.
Definitely. Family is absolutely central. Strong sense of mutual support, obligation within the extended family. Personal stuff often stays within that circle.
The guidelines also mention maybe a more concrete, tangible approach to life, less focused on long-term abstract stuff, and maybe attributing events more to external factors, luck, fate, God.
That can be a tendency, yes. More present focus, practical. And a stronger external locus of control might influence how much personal agency someone feels they have over life events.
How does that play out in a therapy?
Well, the recommended approach is often active, directive, and multimodal, looking at behavior, feelings, thoughts, relationships, even biology. Pretty comprehensive.
Okay. tackling it from all angles.
Kind of. And family therapy is often highly recommended precisely because of familismo. It just fits the cultural emphasis on family.
Makes sense.
Yeah.
Leverage the existing system.
Exactly. Other tips include personalismo, building that warm personal connection once initial respect is shown, being aware of maybe more traditional gender roles or family structures,
Okay.
recognizing that different family members might be at different levels of acculturation, which can cause stress, and definitely considering religious or spiritual factors, and again, being alert to somatic complaints.
Lots of layers there. Okay, finally, let's talk about sexual minorities. The data mentioned shows higher rates of depression, anxiety, substance use, suicidality. It's tough stuff.
It is, and it's absolutely critical, foundational even, to understand why. The research overwhelmingly points to prejudice, discrimination, stigma, the societal environment as the driver. It's not inherent to being LGBTQ plus.
That distinction is vital. The distress comes from the outside in, essentially.
Right. And common reactions to that stigma can be things like pulling away socially, isolation, or developing what's called internalized homophobia or transphobia.
Which is when you start believing the negative messages yourself.
Exactly. You absorb those societal judgments, and it can wreck your self-esteem, cause self-doubt, contribute to mental health issues, really damaging.
So therapy can help by tackling those negative thoughts, building coping skills, assertiveness, finding support.
Yes, those are key interventions. Challenging distorted thinking, learning how to navigate prejudice, building resilience, and connecting with supportive communities or a chosen family. It's empowering.
The coming out process is mentioned as really significant. Why is that such a focus?
Well, coming out, disclosing your orientation or identity is often a huge developmental journey for LGBTQ plus folks. It can be risky, absolutely. Lots of fear involved sometimes, but research strongly links it to better mental health over time.
Right, the text mentions links between being more out and higher self-esteem, positive feelings, less anxiety.
Yeah, living more authentically, not having to hide a core part of yourself, reduces that constant stress and vigilance. It's liberating psychologically.
So greater outness across different areas of life generally correlates with less distress.
Generally, yes. The more contexts where someone feels safe and able to be open, the better their well-being tends to be.
And there was a note about gender differences in timing for coming out milestones, but maybe recent research shows less difference. Sounds like it's very individual.
It's definitely a personal journey. Timelines vary wildly. While there used to be observed differences, like males maybe realizing attraction earlier, the age of actually telling others might be becoming more similar. But yeah, main point. It's complex, individual, avoid assumptions.
Okay, wow. That was a lot, but incredibly valuable, I think. So to kind of wrap up, the big theme is just how vital cultural awareness and sensitivity are, right?
Absolutely vital.
When trying to understand anyone, really. But remembering, these are guidelines, not rules. Avoid stereotypes at all costs.
Crucial. It's about appreciating how values, family, history, society, all this stuff shapes us, but doesn't define us rigidly.
And for everyone listening, this isn't just theory. It's a practical framework for interacting with people every day at work, with friends, family, just out in the world.
Exactly. Recognizing these potential influences can just lead to more empathy, better communication, richer connections, understanding, basically.
So maybe a final thought to chew on. What assumptions might you be making, maybe unconsciously, about people based on their background? And how could trying to see things with a bit more nuance change your interactions?
Good question to sit with.
Definitely food for thought. Thanks for joining us for this deep dive.